Thank you. So, a disclaimer, I'm usually asked to give talks like Sarah Henderson or Colleen Reed gave this morning on overall health effects. And when I agreed to speak on messaging to the public, I thought it was because I'm often that messenger in Northern California. I was actually interviewed 32 times after the campfire on November 9th started. But then I found out that the actual title was Evidence for Community Protection Policies. So I had to do a lot of homework, which I'll share with you, because I actually didn't know what evidence there was or wasn't. And I don't know if Linda Dix Cooper is in the audience, former MPH student of mine at UC Berkeley. She turned out to have done for BC CDC one of the best reviews of evidence with regard to some of the policies I'll be talking about. So I'm going to talk about recent California fires just to set the stage, because I hope it doesn't get this bad in British Columbia as we've had in the last 2 years in California. Public health messaging, that's one of my charges. Clean air shelters, evacuation, the evidence for the effectiveness of these policies. And I'll put it in the context of things I've been asked in California. So here's the first fire where I really got a lot of requests from media and governmental organizations about what to do. This was the Sonoma-Napa wildfires. There are actually more than one. The Tubbs fire was the biggest one. Wine country, beautiful area in Northern California. And the air quality south of this in the San Francisco Bay was actually, at that time, some of the worst that had ever been recorded with regard to PM 2.5, because we normally, like Vancouver, have pretty clean air. A couple months later, when the wildfire season is supposed to be over, in December of 2017, there were these 3 big fires. In Southern California, the Thomas Fire at that point was then the largest wildfire in California. And I just showed this right after Rob's talk on purpose, because this was in one of the major media outlets as an example of how people were trying to protect themselves from the health effects of the Thomas Fire smoke in LA. And I'm not sure that they were getting the protection necessarily they thought they were, especially the young girl in the middle. Again, even though this is a 2009 report, this is just one of the, you've already seen several of these today, showing what climate projections generate with regard to risk of wildfires. And by mid-century, it'll be 55% increase from 2009 and over 100% by the end of the century. And this is graphically showing warming effects on wildfires, with the yellow being the lower warming range, which we're not going to achieve. We're already in the medium, I would say. So it's going to be here in British Columbia, as Michael talked to you about earlier. We're going to have more wildfires. And even if we start getting our act together with regard to reducing greenhouse gas emissions, all of the CO2 that's already in the atmosphere is going to keep us warming for a while. So we get used to it. We're going to have more wildfires. And then here's the most recent devastating fire in California, the Camp Fire. This is showing Paradise, the town that was completely destroyed by this fire. I'm going to come back to this fire later. So what's this slide? This is showing on the right the US EPA guide for public health officials in terms of wildfire smoke. And then on the left, it's basically saying we need planning and readiness. You've heard that from other people today. By the way, Sarah Cofield, I want to clone you. We need multiple people like you in communities in California. It's really incredible work that you've done. So we need to get ready to prepare, because there's going to be more health-related problems due to wildfire smoke exposures. So a wildfire, and here's showing, it's interesting, we just talked about the air quality index. I have to admit, I don't know the Canadian air quality index, but in the US, the air quality index, it's based on really two pollutants. It's theoretically all the criteria pollutants that EPA regulates, but it's actually PM 2.5 and ozone. And it's tricky for a summer day, a hot summer day where ozone is elevated. The actual number reflects ozone and PM 2.5. But in November, when the campfire occurred, it was all PM. The problem, though, is that for air quality people and air pollution health scientists, we think, when we hear 100, that's 100 micrograms per meter cubed, but it's actually not. So the air quality index, when it gets to 200, it's often like 70 micrograms per meter cubed PM 2.5. I don't know the number off the top of my head, but it's not directly equatable. This is how the US EPA ranks the health warning for the air quality index. And so when you get to 101, then it's unhealthy for sensitive groups, the vulnerable groups we've been talking about today, people with asthma, COPD, heart disease. 150 to 200 is unhealthy for everyone. And then over 200, which we reached multiple times over the past year in California, is very unhealthy for everybody. And over 300 is hazardous, and we reached that this summer with the campfire. I shouldn't say this summer, this fall. So again, this is public education right from the US EPA document. It's showing how you properly wear an N95 mask. And they recommend for the susceptible folks with pre-existing heart and lung disease to have an adequate supply of medication, have a written asthma plan. They suggest maybe getting a portable air cleaner. And then make sure that you are working with your healthcare provider to make sure that you have a plan in case you have symptoms related to the smoke. And then only use appropriate respiratory protection, whatever that means. So I'm glad that Rob mentioned this study twice. I actually was a reviewer of this paper when it was submitted. That's because I've done my initial work with Wildland fires was to study the firefighters. And I'll just mention parenthetically, so the Wildland firefighters in the U.S. Forest Service are very fit folks. They have to meet a fitness requirement, and they exercise every day, whether they're fighting fires or not. We measured their lung function in April, which was then the start of the fire season, and again in October, which was then again the end of the fire season. And we showed both decreases in spirometry, lung function, and I measured airway hyperresponsiveness out in the field with methylcholine challenge. Never do that again. But that also changed over time for the worse. But we don't know what happens between the end of a fire season and the next fire season when they're not exposed to smoke. Anyway, going back to the Hoopa situation, and this is a First Nation area. There's two tribes, the Hoopa and the Yurok. I visited up there. They get prolonged inversions during the fire season, and so they're exposed to pretty heavy smoke for, in this case, months. And they were only measuring PM10 at that point up in this area. CDC investigators, the US CDC investigators documented the expected increased healthcare utilization for respiratory problems. So this was hospitalizations, ED visits, doctor visits. And if they surveyed people, and if they remembered public service announcements they had hearing them, they had a reduced odds of reporting adverse respiratory health effects. So this was some evidence that people who listen to PSAs actually heed the advice. So I mentioned Linda Dix-Cooper. She did, for the BC CDC, an evidence review of PSAs, and there's been some evidence since, but limited evidence about effectiveness of public service advisories about wildfire smoke. Simple and non-technical messages, as I think Sarah pointed out very well, with jokes, are best recalled. And recall depends on sociodemographics. I mean, it's not surprising, but better educated folks, wealthier folks actually tend to recall, and people with pre-existing disease, that's an important one. The at-risk people, they tend to recall PSAs better than others. Some populations are less likely to hear PSAs. This would be folks where English isn't the first language if the PSAs are in English, people with lower education and more economic disadvantage. Compliance is best for stay indoors and reduce outdoor physical activity. When you ask about compliance for masks, going to a place with clean air, or actually even controlling the ventilation or filtration in your own home, that isn't complied with as well. And again, the compliance depends on the same sociodemographics that I just mentioned. So here are a couple of specific studies. There was one related to emergency health risk communication during the 2007 San Diego wildfires. And it was a pretty big survey, 1,800 respondents. 88% reported hearing, some fire-related health messages, and everybody understood those messages. The respondents complied with most to all of the non-technical health messages again, staying inside the home, avoiding outdoor exercise, keeping windows closed. Few recalled hearing technical messages to replace air conditioners on recirculate, use HEPA filters, or use N95 masks during ash cleanup. And less than 10% of all respondents followed the specific recommendations. This one is actually a qualitative study that was actually a pretty interesting read. It was about fire management professionals, whether they're air quality folks, forest service, forestry type folks, or health department folks that had to respond to wildfire issues. And it was basically focused on prescribed burns. Everybody knows that term, right? So burns to reduce the risk of a catastrophic fire. And California, Montana, Oregon, and South Carolina. And the interviewees said one big problem was inconsistent messages across agencies, and actually within agencies even. And uncertainty about the effectiveness of their messages. I guess they didn't tell dumb jokes, but and they recommended that agencies need to prioritize smoke-related communications. They had to get good at it. And they had to allocate training so people could get good at it. I think Sarah could go into business for this. And then long-term relationships between agencies and the public, those leaders of the community that Sarah mentioned, they suggested that was very important. And then using informal social networks. Speaking of social networks, this was an interesting paper from Australia that came out after the BC CDC review of the evidence. Twitter data offers opportunities for public health professionals. The report assessed Twitter data regarding asthma symptoms during a bushfire in New South Wales during October 2017. And not only did they suggest this could be used for syndromic surveillance, as we heard about earlier today, but they also thought it could be important information for getting the public health message out. And respondents, actually this is multiple studies, say they like personal communication better than PSAs. So this is where they actually said they wanted a phone call, a robocall, I don't know. But maybe Twitter would be a good way to reach people personally. This was a paper from the EPA group that's been mentioned, Wayne Cassio, Anna Rappold, and others. And they had studied a wildfire in northern North Carolina, I believe. And they'd already shown that there were health outcomes as we might expect. But then they wanted to go back and see, this was a simulation study really, if they had used the forecast, there's a NOAA forecast modeling, could they have gotten health messages out that would have reduced the health and economic burden? And the interventions were simulated in adults with asthma and adults with congestive heart failure to hit respiratory and cardiovascular outcomes. They used different thresholds, different levels of the AQI, and they modeled different levels of adherence. But this modeling exercise did suggest that if you started at the right threshold, and they suggested below 20 micrograms per meter cubed, so I don't know, that's an AQI over 50, I don't know. But anyway, they suggested that would lead to the greatest risk reduction. I don't know. Now this is the review that really I learned the most from. Recently published last year, or actually 2017, and they included Linda Dix Cooper's BC CDC review, but then added additional studies. And there's three main messages. Smoke-related public health messages can be communicated in a variety of channels, but there's limited evidence regarding their effectiveness for the general public or even at-risk groups. And again, messages that use simple language are more commonly recalled, understood, and complied with. No surprise there. And at-risk groups should probably be advised to stay indoors before the general population in order to protect the most vulnerable folks. I only showed this complicated flowchart. They looked at 2264 different documents, and they decided there were only 10 worth looking into in detail. So even though there's been a lot of verbiage out there, there's only a few good quality studies. Now, the next policy that I was asked to review the evidence for was clean air shelters. And again, I turned to BC CDC. And there's virtually no evidence. So that was easy. But then this was a nice review because it looked at feasibility of using large air-conditioned spaces, public libraries, malls, shopping malls. And bottom line, as Sarah already intimated, you need information about the air exchange rates and the filtration in these places. My wife has asthma. She's been exacerbated by wildfire smoke before, and during both the Sonoma-Napa fire and the Camp Fire, she wore an N95 mask when commuting from Berkeley to San Francisco. She works at San Francisco State University, but she moved her class, she's a historian, she moved her class into the library because there was a new library building that was well ventilated and well filtered. So again, there's different types of filters in these public spaces that we might be considering for clean air shelters. But a big issue, the ease or difficulty of travel to a clean air, community clean air center. It's not trivial. Basically, they suggest that benefits of staying at home, if you had a pretty clean environment at home, is probably better than going to a community clean air center. Because if smoke events are reported to persist, there's problems with prolonged stays at clean air centers. On the other hand, I think, as Sarah suggested, a place to go where people can hang out where it's clean seems totally reasonable, but that's different than living there. And again, this Hoopa study comes back. they showed that increased duration of use of HEPA air cleaners was associated with reduced odds of reporting adverse respiratory health effects. These are HEPA filters at home. I don't know how they got it funded, but a number of folks actually were able to have HEPA filtration devices at home. These are very poor First Nation communities, so somebody provided that funding. I don't know who. Actually, no protective effects were observed for duration of evacuation. This is a separate point. Some people were evacuated, and they stayed in hotels, I don't know, 20 or more miles away. And even if people stayed away from this area for 2 weeks, there was no evidence in the data that that helped. And as other people have mentioned, evacuation is problematic at multiple levels. And so that's also been reviewed by BC CDC. And there's little evidence of the effectiveness of evacuation. In fact, this document, which was published in 2014, the only study was the Hoopa study. And they pointed out that previous evacuations, this is evacuations for smoke. Obviously, if the fire is coming to burn your town, you have to leave. But with regard to health, when nursing home residents have been evacuated, there have been problems and even deaths related to that. There are infectious disease among those residing in shelters. This actually happened with regard to the Camp Fire. There was a cholera outbreak in one of the prolonged shelters in Northern California. And as Colleen pointed out earlier, mental health problems in both adults and kids have been documented related to evacuations. Now, how much of that, well, the stress of evacuation and being away from your home and being away from all your normal stuff is, I think, great. Again, some more vulnerable people might need to evacuate. So the urban wildland interface has been mentioned, and we have more of a problem with this in California than I think you do up here in British Columbia, because we've allowed major development into woods. And that brings up a different type of smoke exposure, because it's one thing when wood and vegetation burns, it's another thing when the synthetic materials in our houses and cars burn. A lot more toxic stuff. Now, how much of that is transported at long distance? Probably not that much. But downwind from the fire, like the people who lived in Chico, just downwind from Paradise, we're probably exposed to a lot of nasty stuff in addition to the nasty stuff, not a lot of nasty stuff from synthetic materials burning in addition to the forest fire. So when buildings and vehicles burn, there's hydrogen cyanide, hydrochloric acid, phosgene, metals, toluene, styrene, dioxins. There's a reason that structural firefighters wear Scott air packs and breathe clean air, which is totally impractical for wildland firefighters. And many buildings and motor vehicles have been burned in these big California fires. And so local residents exposed to more than wood smoke. But I think the plumes that traveled long distances probably were mostly wood and biomass smoke by weight at any rate. So I have a couple case studies to end with if I have enough time. I don't. Okay, I don't need long. So I work at UC Berkeley, and the AQI on October 13th, after the, well, it was during the Sonoma-Napa fires, was over 200 during the day. And, you know, it was at least 70 micrograms per meter cubed to PM 2.5 in the monitor closest to Berkeley, UC Berkeley. So the UC Berkeley issues a health advisory to students, staff, and faculty. Stay indoors, consider wearing an N95 mask if you have to be outside. Class is not canceled. The Bay Area Air Quality Management District asked UC Berkeley to cancel a televised football game with Washington State that evening, and they didn't. Because the AQI got to less than 200 by kickoff, and the NCAA National Collegiate Athletic Association has a 200 AQI cutoff. So, with the campfire, we had much worse air quality. This is just showing the satellite view of the plume. And so at the bottom down there is the San Francisco Bay. The AQI goes over 200 Thursday, November 14th, and is projected to stay high for days. So this time, UC Berkeley cancels classes but does not close campus. And the reason they didn't close campus is there are a lot of new buildings that actually were nice places to be during the fire. And then they postponed the big game with Stanford, scheduled for Saturday. So they learned a lesson or two. In Sacramento, this is again with the campfire. On November 15th, the AQI goes over 300 in Sacramento and over 400 in Yuba City, which is more directly downwind of Paradise. You can see the air quality index map. Purple is over 200. The city of Sacramento starts providing free N95 masks at fire stations. But then the Sacramento County Health Department advises against wearing N95 masks because of false sense of protection. So here's that consistent messaging that we talked about. So I'll just end with a quote from our past governor, which I like. He said this during the Thomas fire in December 2017. We're facing a new reality where fires threaten people's lives and health, I might add, their properties, their neighborhoods, and cost billions and billions of dollars. We have to have the resources to combat the fires. We have to invest in managing our vegetation and forest. And before he left office, California has allocated $1 billion for forest management. It's only a little bit of what's needed. But it's a place that's getting hotter, so it's only going to be more fire more of the time. Thank you.
Thank you, Dr.